Alright, so today I will be using the Intellect TENS unit. So what we're gonna do is you're gonna slide this top piece down so that way we'll see the different buttons, the mode, set, and the up and down. And then in order to turn it on, you're gonna go on that left side and you're gonna hear a beep, and then you'll see these guys on. Okay, so right now on the mode, we are on normal. So we're gonna keep it there because for normal, that's going to be used for conventional TENS as well as acupuncture TENS. The only difference is we are going to be changing the parameters. So if you wanna change the mode, you're gonna press this guy. That's gonna be modulating. The next one, we're not gonna focus on that guy. And then we have bipulse and then burst. So for the purpose of this video, we're gonna go back to normal. So in order to change the rate, you're going to come here and press the set. So the rate is the frequency. And for conventional TENS, that is going to be between 30 and 50. So I'm gonna go ahead and make sure that number is beeping, and then we're gonna go up to between 30 and 50. Okay, there we go. And then once we get that number, so rate is frequency, and then width is going to be related to the duration. So for the duration, it's going to be between 50 and 100. So I'm gonna make sure that that number is blinking, and we're gonna go down to between 50 and 100. So I'm gonna put it at 100. So when that is set, you're gonna press set, and then this is going to adjust the time. So we're gonna go about 20 minutes for the purpose of this video, and then that is set for conventional TENS. Conventional TENS, the current is symmetrical biphasic. What it does, it reduces pain using the gate control theory, so it blocks those nociceptors from reaching the brain. That way you mask the pain basically. So this only works when the machine is on. It produces a tingling sensation, and then the effects only last as long as the machine is on. So when doing this, you want the patient to perform a functional task, such as if the place is going to be on the shoulder, you can have them pick up a box off of the ground or pick up a coffee mug. So that is for conventional. So now for acupuncture TENS, it's going to stay on the same mode. So it's going to be normal, but we're just going to change the parameters. So we're going to go back to set, and then this is the rate. So we know we want to change the rate, the frequency. And for acupuncture, that's between 2 to 5. So it's at a lower level. There we go. So I'm going to bring it down to 5, and then I'm going to set that. And then the pulse duration, or also known as the width, is between 100 and 300. So I'm going to keep it there. And then the time again, we're doing 20 to 45 minutes. So with this one, the patient will be feeling a little bit less uncomfortable because it's going to have a tingling feeling as well as a muscle twitch. So you're actively going to see that muscle twitch. And this uses the endogenous opioid theory. So what this does is when the machine is on, the body releases opioids that kind of bring the pain level down. So this method lasts a lot longer than the conventional TENS. It can last between 24 and 48 hours, and the machine does not have to be on. So it's a continued effect. We'll also want to perform a functional task as well. So like I said, for doing the shoulder, we're going to be picking up a box off of the ground, or picking up a coffee mug off the table, or an object off the table, and bringing it to, our head. So then the last one is going to be burst mode. So we have to change that from normal till we get to burst. So that's modulating, that's SD, that's bipulse, and then we're here at burst. So with this one, we can only change the duration. It's between 150 to 500. So I'm gonna go about in the middle. So let's go to 300. Okay, so then the frequency is fixed at here, and I believed on this machine it's at 100 megahertz. So the rate slash frequency is fixed. All we're doing is changing the duration, and then we change the time limit, which is, again, we're actually gonna go about 15 minutes or till the patient tolerates, because with this one, the intensity is a noxious stimulus or a motor response. The sensation they'll feel, it will bounce between conventional and acupuncture, so they're gonna feel a tingling sensation, and then it'll jump into a muscle twitch. So whichever the patient can tolerate with this one. Okay, and that was the 3 modes of the TENS, so conventional, acupuncture, and bursts, and that is it. Okay, so for this blinking number, the rate in megahertz, that refers to the frequency. So the frequency is the number of electrical impulses that is going to recruit the muscle fibers. So the higher the frequency, the larger muscle fibers it's going to innervate, and then the lower the frequency, where did it go? There we go. The lower the frequency, it's gonna have less electrical impulses, and then the higher it's gonna recruit more. To be doing the 3 different modes of 10 on her shoulder, and I'm gonna kind of do it here on the deltoid. So first off, you want to treat the area with an alcohol wipe. And then since alcohol does dry out the skin, we want to wipe it off with a wet towel, that the conduction of the electrical impulses will actually penetrate. Okay, so for the unit, we have 2 different channels. So with the TENS, we want the electrical stimulation to run parallel to each other. So you're going to make sure that one channel runs parallel this way, then the other runs that way. Okay, perfect. Then I'm going to go ahead and turn on the unit. Okay, so for the first one, we are going to be doing conventional TENS. So she's going to be feeling a tingling sensation. So the mode is already on normal. We're going to go ahead and change the rate. So the rate is how many muscle fibers are going to be recruited to that area. So for conventional, we're going to have it between 30 and 50. Oops. So make sure that number is blinking. I'm going to go about 30. And then the width or the pulse duration is going to be 50 to 100. So I'm going to bring this guy down. Let's do it at 100. Okay, and then we're going to press set, and then we're going to do so we're going to go about 20 to 30 minutes for this one. So with this one, you want to explain to your patient that they're going to be feeling a tingling sensation, and this works by the gate control theory, so that's going to block the pain receptors from reaching the brain. And then we're going to change the intensity using these 2 knobs here. Okay, Fernanda. So we're not going to see no visible muscle contraction. Let me know once you start feeling something.
Okay. Ooh, I feel it.
Feel it? Is it kind of strong, or is it okay?
It's pretty strong right there.
Pretty strong?
Yeah.
Okay. So we want, for this one, we want her to perform a functional task. So for example, I'm going to have her pick up this water bottle, and she's going to bring it to her as if she was drinking it. Good. I'm going to do that about 5 times. Perfect. Okay. So now, so that is the first one. The next one, we are gonna stay here at the normal mode, but we want to do acupuncture tens. So what you're gonna do is we're gonna now change the rate or the frequency to between 2 and 5. So it's a lot lower. So that way we're getting the endogenous opiate theory. So we're gonna go at about 3 for this one. And then we're going to change the pulse width is going to be between 100 and 300. So I'm gonna keep it at 100 for now. And then with this one, we are going to see a visible muscle twitch. So as we see that change right away. And then you're also gonna have them do a functional test. So Fernanda, we're gonna go again, like we're drinking the water bottle, about 5 rounds. So we are seeing that muscle twitch in that area. This one's a less uncomfortable for the patient, but the effects last a lot longer, about 24 to 48 hours. The machine does not have to be on, it'll still be giving that opioid relief. Okay, so the next one is going to be the burst mode. So for burst mode, we're gonna come back here. We have to change that from normal. So you're gonna come from mode, and I'm gonna actually turn this off and then turn it back on to reset. So we're gonna go until we see that burst here. And then with burst, the frequency is already set at 100 megahertz on this machine. So all we have to change is that width. So the width is going to be between 150 and 500. So I'm gonna go in the middle. We're gonna go to 300. So with this one, what the patient is going to feel, it's going to jump between a tingling sensation, so the conventional, and then the acupuncture, the muscle twitch. So it's gonna bounce in between those two, and then the time is going to be about 15 minutes. So we're gonna press set again to get that down to 15 or with the patient tolerance. And then I'm gonna go ahead and turn this guy on. Let me know once you start feeling.
Okay. Right here.
More on that one, okay.
There you go, I feel it on both.
Okay, so we're watching for, do you feel tingling or more the twitch?
I feel a combination of both.
Combination of both?
Yeah.
Okay. I'm gonna up
There
it.
we go.
There we go.
Yeah. More of a twitch. But
Okay.
when the twitch happens, it feels tingly.
Gotcha. So it's the combination between the both? From both of those guys? The burst? So it's doing okay?
Mm-hmm.
So there we go. So I went a little bit higher on the knobs. So now I am visibly seeing that muscle twitch along with the tingling sensation. And then we're also gonna perform a functional test like we're drinking a water bottle. Let's go 5 rounds with this one. Very nice. Perfect. Okay, and then to turn off this